Hey there. I know that you don't understand the relationship between the outcome of your pregnancy and how this outcome will go ahead to affect the weight of your baby and if your baby will be diabetic later in life. Most of you don't know that your actions before pregnancy, during pregnancy, can determine if your baby will be overweight or obese, or if your baby will be diabetic later in life. Okay? Welcome to Dietitian Review. I am your dietitian Fechi, and this is still a diabetes series. Welcome to another episode of Dietitian Review. Now, today we'll be dealing with gestational diabetes. Now, this is one diabetes that a lot of people are confused about. You know, we know little or nothing about it. Okay, we tend to relate it with type 2 diabetes and all of that. Yet, they have some kind of relationship. Okay, but there are some salient points that I would like to for us to look at, okay, as we review this particular condition. Now, what is gestational diabetes? Gestational diabetes is one diabetes that happens to women during pregnancy. Okay, and there are two forms of gestational diabetes. One is class A1, which is described as a gestational diabetes that can only be taken care of through diet. Okay, that's class A1 gestational diabetes. While class A2 gestational diabetes is one which insulin and other oral medications are used, to take care of. Okay, what are the symptoms of gestational diabetes? You have fatigue, you have polyuria, which is, excessive urination. You have polydipsia, which is excess drinking, that you're always thirsty to drink. You snore, okay? You have breathing problem, and so you snore during sleeping. Increase weight gain, like you gain weight extremely during pregnancy. It will be very obvious, okay? Now, what are the causes of gestational diabetes? Okay, gestational diabetes, the major cause is that during pregnancy, okay, there are a lot of hormonal changes that happen. Okay, the body is flooded with a lot of hormones which are needed for the fetus in the womb to thrive. Okay, so when there are when there is influx of these hormones, what happens is that it overwhelms the function of other hormones in the body, of which insulin is one of them. And insulin plays a vital role. Okay, so when the placenta, okay, there are hormones that are being produced, okay, by the placenta. When these hormones, are produced, okay, what happens is that they submerge insulin, and so insulin becomes some kind of resistance. The body becomes resistant to it, okay, and the function of insulin is reduced, and that leads to increase in blood sugar level. This is the cause, major cause of gestational diabetes. What are the risks of gestational diabetes? There are quite a very long list of, risk involved in gestational diabetes, and I will try to run them down as quickly as possible. You have high blood pressure. If you're hypertensive, okay, there's a chance that you will actually have gestational diabetes. Your chances are higher than somebody who is normal. You have a family history of diabetes, you have a greater chance. You are overweight or obese, you know, before you got pregnant, okay? You have more than just one baby, okay? Like you're carrying twins or more, you have a greater chance. You have previously, you know, given birth to a baby that had more than 4 kg at birth, okay? That's microsomic baby. Yes. If you've given birth to a microsomic baby, then you stand a greater chance. You've had gestational diabetes in the past, had an unexplainable, an inexplicable miscarriage or stillbirth. You have been on some drugs like some glucocorticoids. You have polycystic ovarian syndrome and other conditions that are related to it. You are an African American, Hispanic, Indian American. These are the major risk factors of gestational diabetes. If you belong anywhere in this category of people I mentioned, then as a woman, it's a risk. Okay, I'll tell you what to do at the end of this video. How do you diagnose, gestational diabetes? Now, I would want to run it down. Okay, I would like to run it down because it's a form of a kind of a lengthy stuff which your doctor will also do. There is nobody that has that, responsibility to diagnose diabetes, any form of diabetes, except your doctor. Okay, so you have to go see your doctor who will do these things that I will mention. Okay, your doctor will do them. The reason I'm mentioning them is for knowledge sake, for you to know, you know, what they do, okay, and how they do it. But as by doing it, they are the ones that understands the science behind it. Okay, so they should be the ones to diagnose you. This diagnosis will take place in the second trimester. There are two steps to this diagnosis which your doctor will do. Okay, now the step one, I will call it oral glucose tolerance test. Okay, what happens is that you will come fasting. Okay, your doctor will take away your blood, and then after taking away your blood sample, now you'll be given 75 gram of a carbohydrate solution to take. Now, when you've taken this 75 gram of carbohydrate solution, your blood is tested again after 1 hour, after 2 hours. When your blood is tested after 1 and 2 hours, if you have any of the following, okay, this is what it means. If the fasting blood sugar level, which was taken first when you arrived, if it is above anywhere equal or above 92 milligram per DL, it means that there's a possibility you have gestation diabetes. Now, if it is after 1 hour, the sample that was collected, you have 180 or above 180 milligram per DL, you also might be having gestational diabetes. If the sample that was collected after 2 hours shows that you have 153 milligram or milligram per DL or anything above it, it means that you have gestational diabetes. So any of these three, if you have like two of them, okay, as the result, there's a very strong possibility that you have gestational diabetes. Now, these tests can be done more than once or more than twice just to confirm. Okay, so and if the results are consistent, then the doctor will confirm that you have gestational diabetes. Now, the second test, I told you there are two ways they do it. Now, this particular one, you don't need to be on fast. The doctor will ask you to drink a carbohydrate solution of 50 grams. He will test your blood after 1 hour. He will also test your blood after 2 hours. If your blood sugar is between 130 and 140 milligram per DL after 1 hour, then there's a possibility that you have gestational diabetes. The doctor may also recommend another test. These are the following, criteria to know if you have gestational diabetes. And remember, I said it is only your doctor that is licensed to check this. Okay, it is only your doctor that will conduct this diagnosis. It is not meant for you to do it because you don't have what it takes to do it accurately. Complications of diabetes. Now, we have quite a number of complications, and they are as follows. You may likely give birth to microsomic baby when you have gestational diabetes. The microsomic baby means that your baby might have a lot of weight, okay? Anything above between 4 kg and above is a microsomic baby. Difficulty in breathing, your baby may have hypoglycemia at birth. Your baby may also suffer from what is called shoulder dystocia, okay? It is a situation where the baby's shoulder is stuck at the birth canal, you know, so the shoulder is fixed there, and the reason it could be because of the weight, the size of the baby. You have a high risk of having type 2 diabetes later, okay? Especially if you have a microsomic baby. So, what are the treatments? There are two major treatments, okay, that are basic: your diet and the exercise. If you're able to control your diet, talk to a dietitian. You can always talk to us. We'll help you plan out a diet that is suitable for you, okay, during this period, and tell you some of the things that you need to do, okay, to help you. I actually have a friend who called me up. That was sometime last year, and she chatted me and told me that I was diagnosed of gestational diabetes. And I asked her to calm down, that it is not a problem, okay? It's just one of those things that can happen. It's not your making. So I told her, let's work on a diet for you. And after I did the diet and she was getting back to me and we were talking, and before you know it, she had delivered and she was back to normal. Her sugar, there was no issue, you know, and because she learned what to do. Exercise is also very important. Apart from your diet, you need to exercise, okay? You need to start doing some kind of things that you are not used to doing. You actually don't need tedious exercises, okay? All you need is something that will make you get physically active. If you can walk, you can do brisk walking, fine. You can use your treadmill if you have one. You can do jogging if you can. You can skip if you can. You can swim if you can. Okay. You can also do some kind of running, just little jogging, like I said earlier. Okay. It's all about what you can do. Okay. If it's all about what your body allows you to do, nobody needs to enforce it on you. Okay, so whatever it is that you feel your body can do as a physical activity, you go ahead and implement it. Okay, however, you may also need medications. There are times, gestational diabetic patients may need to be given insulin. Yes, you may need insulin, and the doctor will not hesitate to give you insulin if your sugar is rising to a point where it's not coming down, okay, and you're doing the right things and it seems your sugar is not coming down, then the doctor will be left with no choice but to give you insulin, okay, or he will give you a medication. So remember, we said there are two types of gestational diabetes. A1 is that diet and exercise is used to manage that. Okay. And then the A2, class A2, is that you use insulin or, oral medication. Okay. So both of them can serve. All right. So what you need to do is to get a doctor, get a dietitian that will help you manage this condition. And remember, it doesn't mean that you're already diabetic. Okay. It means that during your pregnancy, you are diabetic. And the outcome of that experience will determine what will happen next. Okay. Like I said, it depends on how you're able to manage, that gestational diabetes. It will determine if you will have type 2 diabetes in the future or not. So if I were you, if you are a young person and you're listening to me, there are a couple of things you need to do to reduce your chances of having it. Of course, you cannot prevent gestational diabetes, right? If it wants to happen, it will happen. However, there are things you need to do as a young person to help reduce your risk of having it. What are those things? Try and eat healthy diet. Okay? Stop all these lots of fries, lots of empty calories that you take. Okay? Try as much as possible to incorporate fruits, vegetables, whole foods, okay? More of whole foods, that's complex carbohydrates, into your food. It will help you a whole lot to reduce your chances. And then don't live a sedentary lifestyle. Get involved in physical activity, be active as a person. Okay, the more active you are, the more chances you reduce. Okay, the more of the chances you reduce. If you are already overweight or obese, I know you may not understand, but you need to know your BMI as a person, as a young person preparing to get pregnant. Okay, you need to know what your BMI is saying. If you are overweight or obese, you need to start working on it. You can also contact us to help you with some plan that will help you reduce your weight. If this is your problem, okay, get to the description. You will find a link to contacting us, and we will help you, give you some, tailored menu meant for you to help you work on your weight. It's important to seek prenatal care. Okay, do everything that the doctor, all the screenings that the doctor wants you to do, before, during, and after your pregnancy. Okay. And I can assure you, you will be better for it in your health. Okay. Now, I want to advise young people, don't be the reason why that young boy, that young child, that young baby will have diabetes later in life. Thank you very much for listening. If you've not subscribed to this channel, I'd like you to subscribe right now. Click on that link, like this video, and I'll see you next time.